today for our monthly meeting. We have some good stuff for you, some fun updates to provide in regards to different programs that we're operating. So we're excited that you're taking time to be with us today.
Yes, and I just wanted to give a special acknowledgement because we do have the Director of Housing and Workforce Solutions with us today, Ms. Heidi Marshall. And I think we all can agree what an amazing leader she is and how privileged we are to work with her. We've all been influenced by her leadership, and she's always, just lifting up her staff and lifting up the organizations. And whenever I have an opportunity, I want to lift her up too. So Heidi, thank you so much for joining us today.
Well, thank you, Karen. You make me feel super special, but it's my honor to be here. Thank you.
Okay, shall we get started? All right, welcome everybody to the April 23rd Continuum of Care meeting. Ms. Zuli, are you driving on the slides or is it Gershom? You are driving? Okay. All right, let's go to the first slide. Welcome and introductions. Okay, you see, if you are a voting member, I said it before, you see Zuli pasted in. All you need to do is click that link and then you can sign in to make sure that you are counted, because we want to make sure we have a quorum when we do get to action items. So with that, we also would like to take this time in the meeting to welcome any new members or voting members. I think this month we have a new member. It's RB House of Love. Is anybody in the house representing RB House of Love today? If you are, say yes, say a few words. Yes, please go off and mute and introduce yourself and tell us a little bit about your organization. Welcome.
Well, hello, everyone. I am Rochelle Brown. I'm the founder and CEO of RB House of Love. And thank you for having me today. I'm working on my program for transitional housing for current and former foster youth. And I'm also dealing with the Department of Healthcare Services, CH workers, and community-based organization and community supports and all those good things.
Nice. Well, welcome. Those are all such critical, important services for the system of care. We are excited that you are with us.
Thank you.
Okay, let's go to the next slide. Okay, public comments. At this time, members of the public may address the continuum of care with items that are not on agenda. Zuli, do we have any written comments that have been received by the continuum of care?
Yes, we do. We have 6 public comments that were submitted. I will read off the names of the individuals who submitted them. In case they are present, they can read their public comment. If not, I will read it for them.
Okay.
So the first one is from Paul Waite. We also have Susan St. Louis who submitted a comment, Joanne Bolin, David Combs, Yvonne Lang, and David Maynar. Are any of those individuals here that would like to read their comments?
If you're here, raise your hand or speak up. If not, okay, Zuli, did you want to take them one at a time and time yourself on reading them into the record?
Yes, I'll go ahead and do that. The first one is from Paul Waite. It says, to whom it may concern, please reconsider and review the suspension of funding for transgender health and wellness centers' efforts to alleviate some of the housing affordability difficulties in today's rental environment. Thank you, Paul Waite. The second one is from Susan St. Louis. It says, to the Continuum of Care Board of Governors, I am a citizen of Riverside County, and I am writing to express my dismay and disapproval of the county's removal of HUD domestic violence housing funding for the Transgender Wellness Center. The center does important work helping to shield the victims of domestic violence from harm. The growing number of cisgender victims who are being helped proves that the organization is not discriminatory. In fact, the county's actions in removing this funding are themselves discriminatory, hurting the most vulnerable of our neighbors. The reasons specified for the halt in funding are false, and the methods used to strip funding are not compliant with the legal requirements for notification and a hearing before the funding can be removed. This is a miscarriage of justice parading as a concern for fairness. I am appalled that you are allowing this to happen on your watch, and I urge you to do the right thing and restore the funding. Thank you, Susan St. Louis. The next one is from Joanne Bolin. It says, hello, most of the transgender health and wellness centers HUD domestic violence housing funding was taken from them for reasons that appeared to be discriminatory and retaliatory. On March 11th, they requested a complaint form due to county staff pressuring them to violate HIPAA by releasing client-patient information. TH and WCU takes protecting clients' patient information seriously. Later on March 24th, a call was made to the Transgender Health and Wellness CEO stating that County Housing Workforce and Solution Continuum of Care planned to lobby the COC Board of Governance to remove their HUD funding. The Board of Governance voted to allow HWSCOC to remove the wellness center's HUD funding. It seemed this conduct was retaliatory. Did federal HUD tell someone in the county to drop the wellness center or that the county would lose all their HUD funding? Did those that claim to be allies dispose of the center's funding to protect themselves? Per HUD regulations, Transgender Health and Wellness Center is entitled to a hearing before adverse decisions that would impact on their funding are executed. They apparently were not given the right and were railroaded through the system. Can you work with THWC to find a solution that would continue to allow the center to serve the populations that others do not serve or want to serve or are not culturally competent to serve? Please don't cut funds to these vitally needed services to our community. Thank you, Joanne Bolin. The next one is from David Combs. It states, I write in support of the Transgender Health and Wellness Center. For the last 2 months, Riverside County has attacked the Health and Wellness Center in ways that are arbitrary, capricious, biased, and possibly illegal. HUD regulations require that you conduct a fair hearing before adverse decisions that impact funding. The Health and Wellness Center was not given that right, and denial of funding was railroaded through the system. I ask you to 1. Restore funding to the Transgender Health and Wellness Center's program supporting domestic violence and sexual assault rehousing, as well as services aimed at preventing LGBTQ+ youth homelessness and human trafficking. 2. Immediately end your biased and discriminatory behavior. 3. Authorize an independent investigation into the removal of the center's funding since you have apparently taken actions that violate federal and state and county law. 4. Issue a public apology for the false statements made by the Riverside County HWS. Sincerely yours, David Combs. The next one is from Yvonne Lang. It states, Dear members of the Riverside County Continuum of Care Committee, I am writing to express my dissatisfaction with the manner in which HUD funding was stopped for the Transgender Health and Wellness Center. I am not transgender, but as a caring American human being and Riverside County taxpayer, I feel transparency is vital when financial decisions are being made for underserved populations. I was made aware false statements were made by the Riverside County HWS. I am asking you to either present the facts that led to the discontinuation of HUD funding or to initiate an independent investigation into a discriminatory or biased unlawful conduct that may have led this committee to cease HUD funding. Should any violations be found, I demand a public apology for the false statements by the HWS. Thank you, Yvonne Lane. And the last one is from David Maynard. This one states, to whom it may concern at COC. This concerns agenda item number 2 and is being submitted as a public comment regarding the status of funding for Transgender Health and Wellness Center, submitted as an ally and informed bystander. I want to express concerns about THWC having an opportunity to clarify key points, and most importantly, to rectify misconceptions on which decisions were unfortunately based. Chief among them is that THWC is insufficiently inclusive. This is not only erroneous, but demonstrably erroneous. This faulty impression seems to have been based on a single incident in which one cisgender woman who THWC was going out of their way to help had lapsed on certain conditions for her continued participation. Even if this one discontinuation was somehow done in error, it is not indicative of any neglect in extending vital supported services to cisgender individuals in need. In fact, in just the past grant period, February 1st, 2024 to January 31st, 2025, THWC increased its cisgender people served by 300% from 5 to 20, even as there was a 44% decrease to TGI individuals served. To quadruple support for a demographic hardly indicates a failure to serve the demographic. I reference the Homeless Management Information System Annual Performance Report. Even as I write, I am personally aware of, in just the past day, assistance for a fee waiver on a valid ID being extended to a cisgender white man who is currently destitute and in need of help. This includes the much-needed Healing Rainbows Youth Program, convened out of the Marcia P. Johnson Drop-In Center, a fully inclusive service for youth seeking safe refuge from bullying. There is no requirement of TGI status to seek support, as the service is for all youth, period. That bullying is disproportionately experienced by TGI youth is a fact, but it does not follow that THWC is not ready to provide support for any and all youth in need. It simply wants to make clear that unlike many organizations, it goes out of its way to accommodate TGI individuals and more than any other organization is equipped to do so in a fully competent manner. Regarding the matter of dereliction on compliance, this is again a grave misconception. The monitoring audit conducted in August of 2024 was for the 2023 performance. As no audit has yet been conducted for 2024 yet, it is impossible to state that there was such dereliction that I could find. It is almost certain that COC will fund upon any audit that THWC is in compliance and any minor shortcoming brought to their attention can be promptly and decisively rectified. Note that the mock file illustrating what documents need to be included in submissions was not provided during the 2023 performance period. And I'm going to stop there because that was the 3 minutes. Thank you.
Does that represent all of the written comments, Silly?
That is all the written comments, yes.
We'd like to thank every single person that took the time to do what is important, and that's advocacy. Zuli, could you please post a link in the chat to the March 25th Board of Governance meeting? What I'd like to do for the members of the Continuum of Care is to direct them to, regarding the public comments that you just heard, there's a link to the Board of Governance meeting that was conducted regarding the comments that were received today. The Board of Governance is the entity that is responsible to receive policy and funding recommendations and reallocation of funds. So I would direct you to that. And I see you did put that in there. Thank you, Zuli. Okay, let's go ahead and move on to the next agenda item. Leadership Spotlight. Okay. I always am excited to have the chair's leadership spotlight every month, and would like to thank Ayako for being willing to be highlighted this month. She's such an amazing leader and gem to our Continuum of Care, and she wears many different hats. I would like to tell you a little bit about her and read her bio. Ayako is the only full-time real estate developer with a public health background. Valen Consulting was founded in 2008 after 17 years in healthcare business development in inner city hospitals, federally qualified health clinic, venture capital backed national medical groups, and management consulting for companies like Deloitte Consulting in health systems and strategy. Ayako pursued her dreams of entrepreneurship and set out to expand the intersection of health and the built environment. Building safe, healthy, affordable, and accessible housing is the foundation to building vibrant communities. Valen Consulting provides small nonprofit clients with business development and project management services to build and advocate for healthy and affordable homes. Ayako has a Master of Public Health in Health Policy and Management from the University of California, Los Angeles, and a Bachelor of Sciences from the University of California, Irvine. There's so much more that I could tell you about Ayako, and we've actually asked her to wear a few hats today, and I'm excited for her to give you 3 different perspectives, which you can see highlighted on the slide before you. Ayako, I know I represent many people I'd say this, we absolutely adore you. We thank you for all that you do for our continuum of care, and we're so excited to hear your leadership spotlight today. Well deserved. Take it away.
Thank you, Karen. I actually wasn't expecting you to read the bio, but thank you. Thank you for that very gracious opening. Ayako Utsumi here. So happy to share with you today. I'll be representing Inland SoCal Housing Collective, Ballon Consulting, my own practice, and Mary Erickson Community Housing, the nonprofit developer that I'm primarily representing on these calls. Next slide, please. So the Inland SoCal Housing Collective is a nonprofit network dedicated to advance collaborative strategies and innovative solutions to create and preserve safe, decent, and affordable housing in the Inland SoCal region. Next slide, please. We have a membership of about 300, and membership is free. So if you're interested in affordable housing in the IE, you are welcome to join. We are developers, nonprofits, including service providers, institutional, financial institutions, local government, health organizations, and faith-based groups. We are urban, suburban, and rural. We meet the third Wednesday of the month from 1 to 2:30 p.m. virtually, and different subcommittees meet throughout the month. We are announcing our 4th annual Affordable Housing Networking event. It is free, and it will be Thursday, May 29th. That's Thursday, May 29th from 2 to 4 p.m. in downtown San Bernardino. You are all welcome to come and network. Even if you're a service provider, meet the housers and meet lenders, meet government people, meet faith-based people, meet health people, come and network. If we all come together, we will form a stronger collaborative to advance more affordable housing in the IE. So please do come, and I will forward a formal announcement once it's ready. Next slide, please. The next piece is older adult homeless prevention policy. So I work with the state of California's Department of Aging, who's focusing on preventing and ending older adult homelessness. And we have featured our very own amazing Tanya Torno as a panelist for a statewide Department of Aging convening on preventing and ending older adult homelessness. Excuse me, in October of 2023. And Tanya did an amazing job representing the IE and Riverside. And we were, it really was a fantastic event. So thank you, Tanya. As you know, the number of homeless in LA County, age 65 plus, is expected to grow from around 8,000 a couple years ago to nearly 14,000 by 2023. So that's just in 5 years. Now we know the statistics for the IE the trends will be similar, right? There will be an explosion basically of older adult homeless in the next 5 years. So this is why this topic is so important. And we know that our system, generally speaking, is really not set up to meet the needs of older adults who may have cognitive and more medically complex cases, including mobility limitations that prevent them from entering a typical shelter or a typical permanent supportive housing or even other kinds of interim housing. So we need to do more and do better by our older adults. Some potential solutions, we're looking at restoring the state-funded Home Safe. It's been cut. Promote shallow and flexible subsidies, shared housing, another very important tool. Thoughtfully design permanent supportive housing, PSH, through geriatric case management and in-home support, access to more age-friendly housing, integration of aging service providers and the COC system. Of course, Riverside does that already, and more. So again, older adults need a voice, and we see them ignored so often. So that's such an important topic. Next, Mary Erickson Community Housing is an affordable housing developer. Next slide, please. So, of course, a nonprofit, and the mission of Mary Erickson Community Housing is to promote the well-being of working families by preserving and increasing the supply of affordable housing. We do acquisition rehab as well as new construction, multifamily, as well as single family for sale. And we are also interested in permanent supportive housing, which is again our interest in the COC. Next slide, please. I wanted to bring to your attention a special program we have called Employer Assisted Rental Housing. The Waldorf Astoria Monarch Beach Housing Initiative in Dana Point, yes, that's Orange County, operates a Section 8 housing voucher-like program, but it is paid for by the hotel. So in high cost of living areas along the coast, they have a harder time attracting hospitality, who are primarily lower wage workers, to their businesses. So by providing a Section 8 type of voucher as a housing subsidy, we have a win-win. The hotel wins and the employees win. I have a quote here from a tenant. We were forced to live apart until Metch helped us find affordable housing in Orange County close to my husband's job. So again, we know a lot of IE people do commute very far. So again, these types of programs really are one tool we have in our toolbox to promote more affordable housing. Next slide, please. Another project I wanted to highlight is called East Point Village in the Arden and Guthrie area of San Bernardino. It's 13 scattered fourplexes, 50% AMI rentals, and we are the hot pink parcels. So it's very scattered. Next slide, please. These are some East Point Village before photos. It was a very rundown fourplex neighborhood. Next slide, please. And ta-da, the after pictures. We wanted to talk about not only did they become more beautiful, but we helped to transform the area with what we call affectionately the Pizza Hut effect. So in this neighborhood, Pizza Hut did not deliver because of crime. And I think a lot of us are familiar with such neighborhoods. But because of the work that we did working with residents in the neighborhood, Pizza Hut eventually did agree to restore pizza delivery for our residents. So we're very proud of the Pizza Hut effect. And we did receive a HUD, a regional award for this work. Next slide. And here's a picture of our grand opening ceremony. Yay, everything. Next slide, please. And what East Point Village means to our residents. So my name is Roberta. I'm a single mother of 4. I went into sober living, got a job. They helped me find affordable housing at East Point Village. It's a wonderful place. I'm able to save money because my rent is affordable. Yes, this is what we're all trying to do, right? Make rent affordable so that people can live their full lives. That's what it's all about. Next slide, please. Yeah, so closer to home in Riverside County in Moreno Valley, we have Myers Park, 27 units, 50% AMI, 2 bedrooms, before and after. If you'd like to make a referral, please do. Next slide, please. We also do new construction of FTHB, that's first time home buyer, 80 to 100% AMI. So we've built homes in Riverside, Loma Linda, Corona, Anaheim. You might, why are you talking about home ownership? That is because, next slide, please. People on this call, your colleagues, or people you know could qualify to be 80% AMI first-time home buyers in Northwestern Riverside County. We're not allowed to announce the details just yet, but we hope to in by summer, and then we hope the homes will be finished by summer of next year. But we are building 7 homes, brand new, $300,000 in down payment up to, for those who qualify, down payment assistance. The mortgages will be about $150,000. Again, it depends. You have to qualify. But please do think about becoming a homeowner. Even in the IE, we know it's out of reach for so many people. So we're very excited to offer this opportunity to the people on this call. Next slide, please. And with all our housing development work, we do use quite a bit of HUD home dollars. So we are Section 3 developers. So we have potential prevailing wage residential construction work projects coming up the end of this year and next year. So please scan this QR code, get in touch with me, get on our interest list so that we may put you, make a referral to our general contractors for local hiring. Again, prevailing wage. And that does it. Next slide, please. Yeah, thank you. Thank you very much.
So does anybody have any questions or comments? Ayako wears a lot of hats, and we truly appreciate everything that she does and always being so kind and gracious. I appreciate all of it. Especially have been excited, Ayako, for the work that you've done in the aging arena. I cannot believe, really, 2003, it was that long ago Tanya did that? It seems like it was just yesterday.
2023.
Yeah, 2023, sorry.
Yeah.
Yeah, but still
Like a year and a half ago.
25.
Yeah.
Where does the time go? Anybody have any questions or comments?
So what I'll do is I'll throw up that QR code to get on the home buyer interest list. I'll do that and put that in the chat. Please do sign up and tell your friends. Yes, Tanya?
I don't have a question. I just wanted to acknowledge, Ayako, all the work that you do and really making sure that Riverside County continues to be on the map and on people's radar. I think you do such an amazing job representing the continuum of care in many state meetings. And I want to thank you for the opportunity that you shared earlier, in which you provided us with the space to talk about all the work that we're doing to address seniors and address homelessness. Again, we wouldn't have had a seat in the room if not for you. So I just wanted to thank you for always representing us well.
And that is because Riverside County COC is so amazing. It's easy to talk about, you all. Thank you.
Okay, thank you again, Ayako. We really appreciate you. Okay, let's go ahead and move on to the next agenda item. Okay, we're moving the agenda around a little bit. We have the coordinated entry system lead update. Lucy, you have the floor.
Hi, thank you. So I'll be going over for the CS lead update for the month of March, and this will be the agenda. So for March stats, that is, next slide. So for March stat, that is an error in the Home Connect calls. It was actually 1,198. Apologies. So it was quite a difference. We have about 965 members on the community queue. We are currently doing a community queue cleanup. So we did house about 46 members. So the areas with the highest numbers of residents on the community queue, Riverside, Indio, and Palm Springs, those cities usually stay consistent. I did want to note, however, that between February and March, for Riverside, about 53 members were exited from the community queue. In Indio, it is 20 less for the month of March than it was in February. And for Palm Springs, there is a difference of 9 as opposed to the month prior. We had about 103 home connections sent out, 56 of which were PSH scoring and 57 of which were rapid rehousing score. Next slide. CES will be collaborating with roughly 5 agencies a month to designate a CES trainee, or for CES to train. That way, agency basic information and step-by-step trainings are even more accessible for each agency. CES will also be working on creating zip folders for all trainings as they're created and distributed to agencies as appropriate. So if you're part of an agency in need of a training until we reach this goal, please reach out to myself or our Home Connect email to give a formal training request. CES has also identified patterns of errors in data and will be working with agencies to reduce lapse of services. Next slide. We are requesting agencies to present. We're currently scheduling for the second half of 2025 for the CES partnership meetings. We are booked up until roughly June and July. Next slide. So we're always looking for feedback. If you guys have any ideas or feedback that you'd like to provide as agencies,
within CES in order to address so we can run CES more smoothly. We encourage you to reach out to myself or again our Home Connect email. Slide. And if you have any questions at all, please reach out. This is our admin team and emails are listed on your screens. Other than that, that's all I have for you all today. Thank you.
Anybody have any comments or questions? Okay, thank you, Lucy. Keep up the great work for the whole team. You know how much we appreciate you all.
Thank you.
Okay, at this time, we're going to move to agenda item 4, consent items. Zuli, do we have a quorum?
We are short about 4 voting members, so if you haven't already signed in, please do so. Thank you.
Okay, so we'll go ahead. Just remind me, Zuli, in case I forget, we need to go back and take action. And you can speak up once we have a quorum, okay? All right, so let's go ahead and move on in the interest of time to the next agenda item. Okay, agenda item 5. The first is 5.1, the Policy Advocacy Committee. This is, I just wanted to give you all an update. You know, initially, when we developed the Policy Advocacy Committee, it has all of these different working groups. We were feeding up policy recommendations from the various work groups because there's one on youth, there's one on health and mental health, there's one on reentry, community education and engagement, I think housing, resources and legislation. And over time, as the continuum of care has evolved, we've been just taking the policy items directly to the continuum of care. And so the only time the Policy Advocacy Committee convenes is if the working groups have some urgent items that they would like to vet, and then we feed up to the continuum of care. And we've made a commitment to you all because we're all too busy for meeting just for the sake of meeting, right? If we're going to meet, it's going to be about strategy and moving the needle. Does that sound good to everybody? So rather than us continuing to cancel the meeting, what we're going to do is just go dark. And then if we need to convene on an ad hoc basis because the leaders of those working groups tell us that we need to do it, we will be sure to be very nimble because we can do that and then send a notice out to you. But otherwise, it'll be dark. So just wanted to give you that update. So if you have any questions or comments, let us know. Otherwise, we'll go ahead and move on to the next agenda item. Okay, agenda item 5.2, letter of support policy. Ms. Tanya.
Good afternoon. This item is on the agenda because one, I want to make sure that I start off by stressing that we want to continue to support any projects that your agency or community has that will expand homeless projects and housing assistance programs, street outreach programs, really right, any intervention that will help us reach more people across our region. So first and foremost, know that I can't think of anything that makes our COC chair happier every time a letter of support request hits our inbox. It is followed by a very positive reaction from your COC chair, who is always reminding us to act urgently because she understands the importance of supporting your grant applications and the impact that the award would mean not only to your agency's mission, but to our larger continuum of care. So what we've recognized is that it is beneficial to implement a formal policy that can be added into our charter. And so if we advance to the next page, and hopefully you've all had a chance to take a look at the documents that we uploaded into the Google Drive that include both the policy in itself, which is reflected here on the second side, or the second document on the screen, and then a form that we will be asking your agencies to complete. So I'll briefly go over the form and its intent or the policy, I'm sorry, and its intent again to really solidify what the letter of support process will look like. Again, recognizing that we are looking to support projects that help advance the COC's mission to end and prevent homelessness. And to that extent, the letters of support will include language that helps advance that effort. We are asking that agencies requesting letters become members of the Continuum of Care. And the process to sign up to be a member is really, really easy. We have a section on our webpage where you can sign up. And as long as you sign up, sometimes we receive letters from agencies who are not yet formal members. We'll send them the link, they'll fill that out, and then we can proceed with the next step. So I just want to stress that that we have a very quick way for navigating that. And because of course we want to be as inclusive as possible, and we're always interested in expanding the number of people and voices that are part of our network. Secondly, the policy states that, again, we're going to verify the project aligns with the COC's mission. Thirdly, we are asking that requests be submitted 2 weeks before your grant application is due as a best practice. You'll see that following this statement, we included language or, of course, a process for exception, recognizing that as a grant writer, right, there's often times where we see a funding opportunity that's due sometimes a day or 2, 3 days later, whatever it may be. And so you may not have the benefit of 2 weeks. So we've been there, we understand. And so we just ask that you provide a justification if that appears to be the case. And again, we will, as we have done, do our best to move that forward. I don't think there's been a request where we haven't been able to turn around a letter of support that quickly. And again, major thanks to our COC chairs, Karen and Michelle, who are always so quick to respond and make that possible. So we ask that the template and that you draft a letter of support. We included a sample here that you could use, be emailed to our coc@rivco.org email that's included in the policy. Once we receive that letter, it will be reviewed again by our team just to confirm that all the items in the policy are adhered to. We then forward those requests to our COC chairs to sign off, and then we usually attach those back in an email to the person that sent it to us. So again, our request for the Continuum of Care today is that you approve this policy. There's a motion attached to the agenda, and we will then add this and make this effective beginning the date following this meeting. Thank you, and with that, I'll pause and see if you guys have any questions.
Ayako?
Yes, thank you for this. Ayako Tsumi here. And this letter is not for when the organization is applying for COC funds directly. Is that correct? It's not for that. Only
Correct,
for
yeah.
external to COC funding.
Correct. Yeah.
Okay.
Yes, and I think the other distinction that we would make is that this letter is very much intended to outline the COC's commitment to the intervention, right, that the agency is applying for that will help expand the COC's mission to end homelessness. The COC would not be able to speak to or validate to an agency's administrative capacity to administer the grant that they're applying for. But certainly, if your agency is administering like a county grant, then right, that would be a different request. So I just want to be clear that the letter of support, this policy is very much intended to provide agencies with a letter that says, yes, this project aligns with our mission to end homelessness. If you, for example, in many cases, if you are carrying out a project that is serving veterans, then we can include some data that shows how many veterans that we have on our by name list to be able to further express on the need for your particular project.
So Tanya, you're needing us to take action on this?
Yes.
Zuli, do we have a quorum yet?
Yes, we have a quorum now. Thank you.
Okay, so let's go ahead and we'll start with this, and then I'd like to go ahead right behind it and get the minutes out of the way. So do I have a motion to approve the template for the Continuum of Care letter of support?
This is Angelina Cole. I make the motion.
Thank you. Do I have a second?
This is Renee Hexted. I second.
Any abstentions or oppositions? Hearing none, the item passes. Zuli, can you just scroll really quickly back to the minutes? Okay, we're going to go ahead and take the consent item. At this time, I'd like to entertain a motion for approval of the March 19th Continuum of Care meeting minutes. Do I have a motion?
This is Angelina again. I'll make the motion.
Thank you, Angelina. Appreciate it. Do I have a second?
Connie Henriquez can second.
Thank you. Any abstentions or objections? Hearing none, the item passes. Let's go ahead and scroll back down to the next agenda item. Agenda item 5.3, Good Neighbor Policy and Guide. Tanya.
All right. So, Karen, I know that we wanted to co-present on this. I thought maybe we could start off with you giving some background on the Good Neighbor Policy, and then I can take it from there on sharing with the Continuum of Care sort of next steps and what this motion would, actually there's not a motion tied to this, what this policy essentially would do in supporting all of our different projects.
Thank you. I'd be happy to give some background. So I think all of us in the room can agree that the last barrier we want to run into when we're trying to expand services and resources is NIMBY, not in my backyard. And a lot of times NIMBY comes as a result of the lack of a good neighbor policy because businesses or residents feel unfairly impacted by either the operational standards, the environmental design, or other issues that would cause a negative impact on the neighborhood, whether it's the siting of an emergency shelter or the siting of affordable housing or an access center, like a day center for services, or even different types of homeless or at-risk services where people will complain that they're worried about an unfavorable impact. And sometimes people will say, it's going to reduce my property values, you're going to bring crime. How many of you, raise your hands, have you run into or heard of NIMBY issues? I'm not the only one, am I? Okay, yes. So good neighbor policies are really super important tools to have in your toolbox to make sure that you do the absolute best to get your program across the finish line and to gain maximum support from different stakeholders who might otherwise go and complain to a local city council and or to the board of supervisors or both. And so it's really designed to provide a win-win-win. And I want to really give credit to Heidi Marshall, because she's the one, I had mentioned the concept of a good neighbor policy back when we were writing our RFP for our shelter navigation center. And we wrote good neighbor policy requirements into the RFP that we would hold our provider to. And we have a very detailed shelter operations plan. And there was a project in the region that didn't use a good neighbor policy. And as a result of that, there were all kinds of complaints from the community and even the local police department, because there was a severe lack of a good neighbor policy. So Heidi actually asked me to present to the Continuum of Care. And so that was, gosh, when was that? Back in 21, I think it was. Yeah, April of 21. So we took a construct of a good neighbor policy to the policy advocacy committee. And it had things like a security and safety plan, transportation services, collaboration with local police and fire, community advisory committee, communication protocols to address concerns and complaints, a 24/7 phone number, really just different elements that organizations can use to make sure that they have an ironclad good neighbor policy that's going to affect a win-win for everybody. So that was adopted as like a best practice at the policy advocacy committee, and then it was taken forward to the full continuum of care to be viewed as a best practice. So that kind of brings us up to speed. Tanya, I hope that that sets the stage for you if you want to take it from here about the policy and the guide.
Yes, I can. So thank you so much. I wanted to make sure that everybody had the background as to how we got here, and what I will say this is that while there is no motion tied to this policy, what I really hope to sort of create a space where we can receive input from all of our members that are on today. And my hope is whether you feel you have feedback to come off on mute and share feedback, you can always circle back with us by way of email in regards to the COC's intent in wanting to adopt a good neighbor policy that, like the letter of support, can be added to our charter and could be something that we refer back to in a more formal way, so that, as Karen described, when we have new projects, that we can have this as a guide or something to point to say the Continuum of Care agrees that as a best practice, projects should take on these steps. So before you'll see a copy of really a draft policy that we'd like for you to review that establishes best practices for community collaboration. We believe builds trust and transparency with neighbors, as Karen described, recognizing that regardless of where on the map you put a project, the reality is there are oftentimes multiple jurisdictions. There are neighbors, within the project itself that are going to be impacted in some way, and so we want to make sure that we take them into consideration. Thirdly, we believe that projects that adhere to a good neighbor policy, really provide strategies to reduce real or perceived impacts. and promote successful, respectful program implementation. And the second document on the right of the screen provides a template. And again, this is in draft form and basically outlining steps or the things that we would want projects to adhere to, which include community outreach and engagement. And we've listed some examples of strategies that would include, facilitating community meetings, maintaining open and ongoing community dialogue with residents. It could be, city, law enforcement, and other stakeholders within the area where the project would be located. Secondly, there is the recommendation that the project or the developer of the project would form a community action committee consisting of businesses, residents, faith-based organizations, right? Different groups that could speak to and have influence over the project. And you'll see as part of our lessons learned that not only have we included law enforcement, but also persons with lived experience. Thirdly, there is a reference to building design. Oftentimes, when we have facilitated community meetings, the biggest feedback we receive is around security, and we've been able to, I think, make the community feel a lot more at peace when they can learn about the project security plan. And so sometimes that is done through having, whether it's formal security or security cameras, a fence as an example that would enclose the project. So this is also, these are also considerations that are included in the template. Fourthly, there is some guidance into the operational standards, which again would speak to how describing a process for like how people would become enrolled in the project. If there are concerns from the community once the project is up and running, is there a number that they can call? So again, some of the things tying back to what Karen said earlier. And then fourthly, operational standards, which again go back to the security and safety plan, but really speak to the collaboration between the project and local law enforcement and police department. Oftentimes the perception is with this project, there's going to be a high number of calls that will impact law enforcement's ability to respond to other efforts. And so it's really, really important. We've learned to have those types of conversations with law enforcement earlier, or as early as possible, and to really think through that process. In a similar project, I think we've heard from law enforcement that oftentimes they support these projects and find that, I think what has been our experience when you stabilize someone in housing and you have staff on site to be able to coordinate care and case management services, call volume actually decreases, right? Because they're no longer on the street in sort of a survival state or standing in front of the grocery store, right? And so listening. So again, this is very much a guide that we would like to add to our charter. At this time, we really want to solicit feedback from all of you on what you think about this, recognizing, as Karen said, that we've brought this to the continuum of care before, but it's been some time. It's been 3-4 years, and also being fully transparent that we would be coming back to the continuum of care in the next month or two to formally adopt this as a policy. So with that,
I thought maybe it might be helpful just to, for those that aren't familiar with this type of a concept,
Sure.
you know, we opened our shelter navigation center in June of 23, and it is a city-owned piece of property that we have 56 beds, and we serve chronically homeless, and it is surrounded by businesses. And initially, the businesses were very concerned about the population that we were serving and the impact to their businesses. And I want you all to know that since we opened in June of 23, there have been zero, I repeat, zero complaints from our surrounding businesses because of the Good Neighbor policy. And I do want to give a shout out to Mercy House. They are our operator. And I know Pastor Charles is on today. We have a full team. And that's just a testimony to the positive impact of being a good neighbor. So. Any other questions or comments? Okay, Ms. Tanya, I know you'll be coming back in the future for us to take action. So thank you so much. Let's go ahead and move on to the next agenda item. Okay, agenda item 6, standing items. Okay, CFC lead agency update. Ms. Emma?
If she isn't available, I am happy to do that on her behalf. All right, I don't see her on, so I'll go ahead and jump in, so you'll get to hear from me a second time. So the big announcement that we have for each of you is that we are getting ready to drop a request for proposals, or an RFP, to identify a new vendor for our youth homelessness demonstration project. And this would be specifically to operate a desert drop-in center that would serve as a main access point for youth who are at risk of or are experiencing homelessness in the Coachella Valley region. We are still very much, even today, working on finalizing that bid application, but anticipate that it will be ready and open beginning May 1st. So keep an eye out for this. If you're not already signed up with our county purchasing department, or somebody from our team will drop a link to their website. You definitely need to sign up if you haven't already, and then you'll receive regular announcements whenever we go out to bid. But we also, as you know, will send out an email through our COC listserv to all of our members so that you can learn more about that funding opportunity. Second, we wanted to share that we are getting ready to release an additional RFP that combines both Emergency Solutions Grant, or ESG funding. So that's our federal funding source that we get on an annual basis, and then state HAP funding, or Homeless Housing Assistance Program funding. So we're combining those two funding sources and looking for vendors to administer rapid rehousing, homelessness prevention, shelter operations, and street outreach programs. And this RFP is also scheduled to come out on May 1st. Exciting opportunities. I know, right? One of the, I think, main inquiries we receive from you all is surrounding new funding opportunities. So I hope that these first two announcements will put you in a good place, and you have some time to sort of prep for those. Thirdly, we're excited, super excited to share that we're going to be commencing our third encampment response program. I know that we shared during the last two meetings that we received or were selected to receive state funds, and this is now our third grant award, and we're very thankful for the great partnership we have with the cities of Murrieta, Wildomar, Lake Elsinore, and even Menifee, who's coming on board to be a part of that effort. I think I saw Brian Ambroise and Lindsay Sisti on the line, who have been key and I think reached out to us at the county and said, hey, this would be a really, really good time to implement a project. And of course, we're thankful to our County Board of Supervisor, Chuck Washington, and Sunday Sales from his team, who have been so involved from the very beginning in not only ensuring that we had the support that we needed to go after the grant, but have been involved at all levels. Like we met, I think 2-3 weeks ago with the members from the different cities and county departments who are all going to be a part of this project. So this project is funding a multidisciplinary team that will be serving residents who are living alongside the Merida Creek Trail, in addition to those that are in the surrounding areas and need access to housing. So we're estimating that about 80 plus individuals will be connected to housing, and we're excited to share that that project launches May 1st. So as you can see, May 1st is a really, really big day for us. Fourth, we just wanted to highlight, recognizing that a lot of you on the line are a part of different agencies who support the Hemet and San Jacinto region, and we want to collaborate with you. We know that you may be offering a feeding program or outreach program. I think what impresses me most about this region is the number of nonprofit and faith-based organizations that are in the community. And to that end, we are hosting a resource fair on April 30th, and we'll have county staff there to help fast track clients to whether it's Medi-Cal and cash benefits, and of course housing assistance. And so if you would like to be a part of that, please reach out to us. We'd love for you to set up and be there to help us serve the community. You can reach out to us at coc@rivco.org. And then the fifth project we wanted to highlight, which I know we've talked quite a bit about as well, is our Project Street Recovery Medicine Project, which also launches May 1st. We have partnered with Healthcare in Action, a street medicine provider, to provide medical supports to our unsheltered population, initially through state HIP investments, and thankfully, as a result of Prop 47 funding that came available through the state, we were awarded additional funds to keep that effort going. So this is part of a 4-year contract, and our goal is very much so that these street medicine teams will work alongside street outreach teams to coordinate care for some of our most vulnerable unsheltered populations, primarily targeting those that are justice or have some form of justice involvement. That is key with this funding source. Is we're looking to reduce recidivism and really reach those who need help in that particular way. And Julie, is there anything else, or is that?
That is all.
All right. So with that, I'll go ahead and pause here real quickly, see if anybody has any questions or comments.
Do you guys need some Starbucks? It's gonna be busy, Tanya.
Yeah. Well, we're busy. All of these projects are in partnership with all of you, so you guys are busy with us. Like, so everybody here needs Starbucks. Thank you all. Again, don't hesitate to reach out if you have any questions. We appreciate you.
Okay, let's go ahead and move on to the next agenda item. Agenda item 6.3, Housing Resource Policy Update. Greg Rodriguez.
Good afternoon, Julie. If you want to go to the next slide, I'm just going to highlight probably not probably, but the major bills around housing and homeless services. The first two is AB 736 by Assemblymember Wicks, and then SB 417, excuse me, by Senator Calvedon. These are basically companion bills, but would establish a $10 billion affordable housing bond that would go on the 2026 statewide ballot. There's pretty good support for both of these. Assemblymember Wicks did try and do a bond last year, but it competed with an education environmental bond, so that got pulled. But this seems to be like I won't say the only bond, but the one with the most momentum right now. And then again, it's really good that it has a companion bill to it. Most of the dollars on this would go to actual construction, but there is some allocation for service provisions as well. So if your organization's in support, I encourage you to submit letters of support to both Assemblymember Wicks and Senator Calvedon. There's our own Assemblymember Core Jackson has introduced a constitutional amendment that would basically establish at least a 5% direct budget allocation to homelessness and housing on an annual basis. This probably has less chance of passing this year due to especially the budget deficit within the state. But a lot of these amendments are actually introduced and then worked on for years in order to get support and more so to emphasize the need for regular ongoing funding. I did want to highlight AB 1229 too. It's an adult reentry grant program. Again, to piggyback off Tanya's, that we're focusing on some reentry programming. And I know that we have some of our partners on the call that specialize in these in this area. And so this would basically restructure the adult entry program, moving into housing community development to better really reduce the homeless among the parole population. So again, providing some of the more concrete resources that HCD has, especially around accountability. And then the final one is our, as we constantly talk about, is the Housing Homeless Assistance Program, or HAP. Round 7, it again was not in the governor's budget. We don't anticipate it'll be in the May revise. However, there is conversations on both the Senate and Assembly side. So we do feel confident there will be HAP Round 7 introduced. It looks like from what we're hearing, the Senate is advocating for $1 billion allocation. The Assembly sounds like they're going to maybe ask for a little less. So we'll see how the negotiations go on that. So those are the major pieces of legislation flying through right now. At the federal level, there's just so much uncertainty. We have no idea what's going on. They're in budget reconciliation discussions now, and so we'll just keep monitoring the programs. But there's fears of cuts to voucher programs. There's fears to cuts to CDBG, to LIHEAP. I mean, the list goes on and on. So again, we'll keep monitoring those as we get more details. We'll let the Continuum of Care know. So happy to take any questions.
Thank you, Greg. Question for the two companion bond bills, do you see, if that's passed, that it would be going through a state HCD or another? It might be too soon to know, but do you see that is what would happen, or?
The bond, probably, yeah.
Okay.
Yeah.
Do you see Jackson's bill connected to HAP? Are they?
No, totally separate.
No?
So, yeah.
Okay, because I mean, everyone's talking about needing to have like HAP as part of the budget every year. So I just wasn't sure.
Yeah, and I think that's really what the Assemblymember Jackson is trying to do, is that to get a budget allocation, then you don't need to have rounds and rounds of HAP after that.
Okay.
So, but for now, until there is a direct, that's basically the HAP vehicle.
Any other questions for Greg? Thank you, Greg.
My pleasure.
Okay, next agenda item, informational items. You can access the committee reports in the Google Drive, and then you'll see we had a busy month of letters of support, Rise Above Defeat, Emmanuel's House, Silence Allowed, and DPSS. So We were super excited about that. And then there are 2 APRs that are available for your review in the Google Docs. Next agenda item. At this time, we can entertain suggestions for agenda items for the next meeting. Does anybody have any suggestions or requests? Hearing none, we'll go to the next agenda item. Okay, this is the time where you can share with us anything exciting happening regarding an event that's coming up or a new program or any other exciting announcement. Angelina.
Sorry, he wouldn't let me unmute. Hi everybody, good afternoon. I just wanted to share that April is Sexual Assault Awareness Month, and we are partnering, Shelter from the Storm is partnering with denimday.org and Peace Over Violence to do National Denim Day on April 30th, which is next Wednesday, and we're asking everyone to wear purple and their denim in support of survivors of domestic violence and sexual assault, in honor of this awareness month, and also to remind everyone that this started years ago when a young lady in Italy was sexually assaulted, and when the case went before Parliament, they told her that he was innocent simply because she was wearing tight jeans, and there is no way it could have been unconsensual because she had to help him take her jeans off. So Parliament the next day, all the women in Parliament in Italy wore denim to stand with her. So we're asking everyone to stand with survivors. Just you want to hashtag Shelter from the Storm on your social media, send us pictures of you in your purple and your denim. We'd really welcome it. I'll be more than happy to circulate some flyers and more information to the full COC, but I wanted to kind of let you know if you can support us. This year's topic is use your voice. We want to stand collectively as a nation, letting people know that we're standing against abuse of all kinds towards people of all races and genders, and it is not okay, and we need to stand together to make a difference. So thank you for allowing me to get on my little soapbox and share. Thank you, everybody.
Awesome. You always have such important announcements. We really appreciate the collaboration, Miss Angelina. Anybody else have any important announcements? Don't be shy. Okay, with that, next slide. Oh, okay, Miss Tanya, you've got some updates for us regarding BOG seats.
Yes. So we wanted to share, and I'm glad that we have good participation today, that we have 4 seats on our Board of Governance that are expiring. First and foremost, we want to thank and acknowledge the 4 members whose names are on screen: Lieutenant Hutchinson, Dr. Lee Johnson, Linda Barak, who has been a long-time member and advocate of the COC, and Anise Smith, who, again, all 4 are just incredible leaders and represent the mission of the COC well in everything that they do. I have been notified that Lieutenant Hutchinson, Linda Barak, and Anise Smith will not be seeking to renew their term with the Board of Governance. Dr. Lee Johnson at this time has shared that he is interested in running again. So to that end, we are looking for nominees to fill these seats. I would encourage all of you to pay special attention to the seat type that is available. In addition to our own charter, HUD has very specific rules surrounding the types of representation that continuums of care will have on their board. And so that includes public sector seats, private seats, nonprofit seats, but very specifically also individuals that represent specific sectors such as law enforcement or victim service providers, representatives from different faith-based organizations, and then having persons with lived experience. So the seat types that are outlined next to each board member's name are essential. And so in the next upcoming weeks, we will be sending out a follow-up email to this announcement requesting for your help in nominating individuals into these seats. So if you are interested, or maybe you have someone in mind that you would like to nominate, please make sure to respond to that email announcement as soon as it becomes available. Once the nomination period closes, then we're anticipating opening up the election period sometime in May. Zulie, I hate to put you on the spot. I'm not sure if you have the timeline available. If you do, I think it would be great to share it. But I know our plan is to have these seats fully occupied before the end of the fiscal year, which is when the existing terms expire. But again, many thanks to all of our board members who really are or work very, very hard to represent the continuum of care and not only support policy, but funding recommendations to ensure that we have equitable coverage across our entire region. Thank you.
I just wanted to add, yes, we will have the nomination period opening as probably in the next few days, and then the new or the elections would begin in mid-May so that they could take office starting July 1st.
Perfect. Okay. There are no other comments or questions. We can go ahead and move on to the next agenda item. That brings us to the end of the meeting. Thank you all so much. There's still 67 people in attendance. I love it. And we are early. It's 4:19. You all are extremely busy, beautiful, wonderful people who do amazing work. So you've got 30 extra minutes to go out and make change in our communities. Thank you so much. That concludes our meeting, and you can see the upcoming meetings right there on the screen.